I just returned from a beautiful cross-country ski at the Whistler Olympic Park. It's stunning, and it's outside,
Oh
and
my
so
God.
there's no risk.
Okay, I am so jealous this morning. So for the last 3 days I've been in bed. I couldn't even contemplate getting out of bed. Like going to the bathroom was like going to the Everest. I had to mentally prepare myself that I would have to stand. And then I kept saying, if I get out of this, I'm signing up for the kayak. I'm gonna sign up for all the long distance cross country race I can imagine. And I'm like, the bar is high for recovery. So I'm super happy you are out there today. Um, you Thank you for being live. For those of you who are watching this, I don't know Cathy. Cathy is a doctor that I've met in Whistler, medical practitioner. She's also a superstar athlete, and she is the CEO of, I have it written down, empoweredmed.com. So thank you for joining me. So it's interesting. Some questions. I think a lot of us think we kind of know what's going on and what to do with COVID until it hits you, and then you think you're not going to get it. I just got the booster by you, by the way. Thank you so much for being out there in the community and volunteering so many gazillion hours of your time to be there. And then I had symptoms, and then I thought it was the booster, and then I was fine, then I wasn't fine, then I got tested, and I had access to several tests because my kids were sniffling too, and we had rapid tests access now. Anyway, turns out we're all positive, except Tristan, for some reason, that survived it all. And so then all the questions came, and I think one of them was, okay, well, so say 3 of us were tested because we had the test, we were positive. There was the 4th of us, like in this case, the husband, that we didn't have a test to test, but we assume he was positive because we're all were positive. So we're like, you know what, let's all isolate. But then he's like, yeah, but Bonnie Henry says if I don't have any symptoms, if you don't have any symptoms, you're good to go. And I was like, yeah, but there's pretty big chances that you have it. And then I realized that in other provinces, in Quebec, for example, you have like different ranking of close contacts. So whether you're high risk, medium risk, or low risk. And so someone that lives in a house with supposedly lots of COVID positive people would be a high risk close contact, and therefore by default should just isolate without necessarily being tested. But it seems it's a gray zone in BC, as if you don't have symptoms, you're free to go. So what are your thoughts on that?
So I think there's a real confusion about what are the rules and why are the rules. So I'm just going to explain it again. If someone is not vaccinated, they're playing by the old rules. They should not be out in the community until a full 10 days have passed from the day of onset of symptoms, 10 days, because of the fact that they're going to have a longer period of time that they're going to actually expel the virus. But I'm hoping that anyone who isn't vaccinated now is really reconsidering for their own safety, primarily, to get vaccinated. Now, for everyone else, if they're double vaccinated, the problem is they're also living in houses where sometimes the children have received one vaccination or they're too young and they received none. So you have to understand that the concept is basically, if everybody is double vaccinated in your household, it's very different than you have children under the age of 5 who've not been vaccinated, or a child who's 5 to 11 who's had one vaccine. So this is where people are trying to understand these concepts, and it's getting more and more confusing. And I understand that. If everyone in your household has had 2 vaccines, right, plus 2 weeks have gone by, and you get COVID, what we're seeing clearly is you're not getting really sick. Now, I understand you feel like hell, right? And that feels really sick. But in medical terms, when we say really sick, it's you're needing emergency medical care and hospitalization and, intensive care. Okay.
Yep.
So if we say, hey, you're going to be sick, but it's mild, that doesn't mean you feel like it's mild. You might feel it's the worst cold, the worst flu of your life, but it's going to stop there. It's not going to go into the inflammatory state that you end up with heart, lung, multi-system problems. And that's what we're clearly seeing. Exception is those who are elderly or who have a lot of other health issues and are vaccinated, because those people don't respond well to the vaccine. So their immunity, even after 3 doses, may not even be as good as yours after 1 dose. And that's just the reality of the immune compromised or those over 70. So if we take those people out of our equation, and we take the children that are 1 vaccine or no vaccine, but if we're talking about everybody else, the thing is that the new rule of 5 days is not if you're sick. If it's your husband has no symptoms, you're assuming he has COVID, you say, well, let's be safe. After 5 days, go out in the community and preferably wear an N95 mask or a surgical mask. But people are confusing this. They're like, well, I'm still sick, but I'm going to go to work. Please don't. If it was a cold and now you pass it on to 5 families, they're going to all be testing and isolating till they figure it out. It's not fair to them, right? It's something ultimately we need to get out of COVID testing when people basically have a cold, which is what the majority of people that are double vaccinated when they're getting Omicron are getting a cold, a bad cold, but they're getting a cold. Does that explain it to you? Like, I can go into more specifics, but it's really the new guidelines of staying home for 5 days if you test positive. If all your symptoms are gone, you feel good, you don't have to stay home for 10 days after a positive test. You can go out wearing a mask. You shouldn't be taking the mask off, and not a cloth mask.
Okay,
Okay?
and the people in your family or in your household, for that matter,
Mm-hmm.
that have no symptoms, should they assume that they have it and isolate with you?
No,
No?
no, that's, I mean, that's
Okay.
the thing. If they're completely asymptomatic, they have no symptoms, they should try to stay away from sharing the same air as you and sharing any sort of droplets
Yeah.
potential with you. So, you know what? It's not always possible. It's not so easy in multi-family households or households with lots of roommates. But you can do, the first thing you can do is the people that are sick and the people that aren't sick, if you're indoors and you're going to share an airspace, wear the medical grade masks, right?
Hmm.
And then don't share bathrooms and share places where you're going to be high touch, and try your best to stay away from those people. Easier said than done, right? But if the person has no symptoms and they need to go grocery shopping or something and they have no symptoms at all, they can go out. If they're double vaccinated right now, they don't have to isolate if they
Okay.
have no symptoms.
Okay. I get that, and
Okay.
thank you for clarifying that. And yeah, see, in our case, anyways, we're all over the place. We have tons of kids. It's like a gone show. So we're like, let's all
Yes.
isolate or let's all be. And then we all tested, and we all tested positive. Some have symptoms, some have not. Whatever. We're staying on lockdown for 5 days,
Yeah.
walking the dogs with our masks, staying away. So now the okay, second question is what, so for the kids, 2 of the kids have had 1 vaccine, 1 has super mild symptom like a mildly runny nose, that's it, the other one has 0 symptoms.
Perfect.
What do we do with them?
So if they feel 100%, okay, 100%, no more symptoms, then at day 5, like past the day 5, they can wear a medical grade mask and go back to school or whatever, because they're going to, oh no, these are the kids that aren't vaccinated,
They
right?
have
They just have
1
one.
vaccine, they just have 1, that's the trick part.
Yeah, so they're in a different scenario than double vax. Sorry, I was confusing it. So if they've only had 1 vaccine and they're testing positive, they should run the full 10 days because they are considered unvaccinated.
Yeah, that's the thing.
Okay? Even though they have 1 dose, they don't have that second dose. So they don't go into that criteria of double vaccinated. You, if you have 0 symptoms at 5
Mm-hmm.
days, you feel great, you can go back. But that's the whole caveat, is a lot of people don't, but they think, well, I'm still sick, but I can go back. No, that's after 5 days and you feel great. You can go wear a medical grade mask and go back into a public setting. If you don't feel good, you should let it run its course till you feel good and stay home.
Mm-hmm.
Does that make sense?
Yeah,
The
totally.
kids that have only had one vaccine are staying in the unvaccinated category, so they should really stay isolating for 10 days.
Oh, all right. And then, okay. Oh my God.
Yes. So this is why it's getting so complicated, because people are trying to understand the rules, but it's a whole different scenario. If you are double vaccinated
Yeah, yeah,
plus 14 days of elapsed, you're going to still get sick. You're going to have virus, but you're going to clear it faster, and
yeah,
you're not going to keep spreading the virus
yeah.
for as many days. Your kids only have one vaccine, so they still fall in that criteria of unvaccinated. The
100% get it.
Yeah, and you know what? When should they get their second dose? The current thing for kids 5 to 11 is 8 weeks. It may change down the road, just like our vaccines changed, if they see the modeling that they feel is problematic for kids. And the unfortunate thing is they're starting to see kids going to hospital, but it tends to be kids that are newborns of people that were not vaccinated and kids with
Okay.
other secondary issues. But they're
Okay.
starting to see that. And that's why we might have to change the 8 week guidance and shorten it. But 8 weeks is ideal for having lasting immunity, because we don't want to be keep doing boosters all the time.
Yeah.
That's not the intent. Yeah.
Okay, I get it. So now I was going like, oh, because man, we've had the kids at home for a long time now, but it's okay. We will survive. Now, so my daughter, who's 8, wanted me to ask you. Okay, so she has about 4 friends that have tested positive that are asymptomatic. They don't really have symptoms, but they have tested positive. They are in this 10-day window. There's the neighbor that wants to go play in the backyard. They're both positive and they're both asymptomatic and they're both in their 10 days. Can she play in the backyard with her friend?
If there's fully open air and they're not sharing secretions, they're not digging into tunnels or making an igloo or sitting in a playhouse, if they're outside and there's open air all around them, they can go play outside.
Okay, but she wouldn't play with her friend who is not positive, right?
Exactly. Because
Okay.
kids and adults, that's why there's different guidelines for, say, in a restaurant. Because reality is, when someone enters your house, a lot of people feel awkward about asking them to wear a mask, and the masks go
Mm,
away. And the sharing of food happens inadvertently, and the sharing of drinks, like, oh, is that my wine glass, your wine glass? Let's
mm,
face
mm.
it, we know we have all done that. And that's why, people say, what's the difference of going to a restaurant and coming to my house? Because in our own house, we forget and we start to do things more normally. That's just so the kids will come in and then they'll share some snacks, and then they'll like grab a water bottle and they'll share it, and they forget. It's normal. So yeah, outside open air, and they're both tested positive, they could play outside. That's not a
Okay,
concern.
because her thing was like, we're all positive. Can we just all positive hang out?
Well, it's certainly an issue, in terms of, can we all hang out indoors? The problem is there's other infections that still spread.
Yeah.
And then people are like, well, do I still have COVID, or now did I get something on top of that? And, sometimes we're just
Just
getting confused. And then there's people doing the antigen tests at home. And, are there false positives? Yes. So, like, it gets a bit complicated. So, we
yeah,
just don't want to add things. We don't want to add
yeah.
fuel to the fire.
Keep it
It's like, if
simple.
yeah, keep it simple. You're outside, open air, go for it, not sharing food or water or anything like that. Open air on all sides, good ventilation, play outside, that kind of thing. But it is, because of the statistical possibility of a false positive, of sharing things inside, and kids are not going to be great at wearing masks, and neither are adults indoors in your own house, right?
Okay,
You know.
I like that. Thank you. Okay, a couple more quick questions because I know you're busy. I don't want to take too much of your time. I keep hearing, I don't care anymore. I just want to get it over with. And I was like, that
Yeah.
doesn't sound like super legit to me. I'm like, for a whole bunch of reasons, but what are your thoughts?
there was a concept of that in the US where people were like, let's have COVID parties in the beginning because they had this assumption that they would get a mild infection. I want to remind you, children are going to hospital. Kids are getting really sick and we don't know the consequences. This is not a normal cold. It has a lot of factors that make it very different. So trying to get something purposely that you don't know how it's going to affect you is not a good concept. So no, I wouldn't agree with that. I mean, I wear, and I have the whole time because I find them more comfortable. I wear N95 masks because
Yeah,
I
I
find them
do too.
comfortable. And one thing people don't understand, you don't have to throw them out. You can keep reusing them 5 times, maybe even 10 times every third day, or heat it up. You can Google that, how to sterilize at home an N95 mask, and you just keep reusing them. And so
Yeah.
they're way more comfortable. They create an air pocket. They seal around your whole nose and face. And on the ski hill, the hard shell ones under your buff is actually nice when it's super cold. It keeps your face warm. So it's a really easy thing to get them if you order them online. And, so you might want to think about ordering some online. And there are kids face ones too that are in 95. You can order them.
Okay, sorry, Chloe, I'm in the middle of a thing. Okay, so
Hi there.
hi, they're saying hi to you, Chloe. You're on Facebook Live. Okay. All right.
Hi.
She's like, don't say anything for one more minute, baby. Okay. And then another last thing was, say I have like three shots now and I've had COVID. Could I say, am I like good to go? Kind of in
Well,
the
this is the thing. This is the thing
talk,
about
Chloe.
immunity that people don't understand is that if you remember your little ones got they got vaccines at 2 months, 4 months, 6 months, 12 months, 18 months, 4 to 6, and then they'll get another different type of vaccine. These are every time our body sees the blueprint to basically how to fight the infection, it gives it another trigger to get stronger. It's like building an army. You keep calling the army, you keep retraining the army, and the army gets stronger and stronger over time. And unfortunately, when you do get COVID, your body has also encountered it. The problem with Omicron is it's a variant that has a lot of other weird things about it. So if we get a different variant, will we still recognize it from getting Omicron, or will it be more like the original ones? So that's the concern that, hey, we don't know what is the future. We all thought medically that it was kind of gone in July. It was very discouraging to see this reestablish, because it looked like we were really good to go. Our rates were dropping, the vaccines. The big thing is the vaccines are holding out. People are not going to hospital that are unvaccinated, that are otherwise healthy. We're seeing that it's statistically working really well, but it's not working to not get sick. And this is the future, is we're not going to test everybody. Once we have all the kids vaccinated, it's going to be a very different thing. But we got this huge pool of vulnerable people. They're called children under the age of 11 that still haven't had the opportunity to get vaccinated. But what I foresee is once all those kids get vaccinated, we're going to encounter COVID over and over, and it's going to be like a cold. And that's when we will stop making this a pandemic. So that's what Bonnie Henry is saying. We're going to get over this, but it's not going away. And then people say, do I always have to get a booster? Well, you may get a flu shot every year, or you may not. And everybody makes a decision. They don't, they're not enforced. Eventually with COVID, that's what we assume will happen, is the older people or the more ill people will get a booster by choice, and we'll really encourage it. And the healthy population, and that's why the healthy population of under 50 wasn't offered the boosters first. It was like, let's take care of the people whose immune system aren't so strong, who need an extra encounter. And now we're like offering it more, but it's not an ideal situation. It's rolling out as fast as the system has allowed, and the system is looking at, is there a way we could do it faster? But all these things take time, and that's the problem. So the booster program is trying to figure out other ways to get it out faster. but in between there was Christmas, and it's a human element of all of this.
Mm-hmm.
Yeah.
Cathy, thank you so much for taking the time. That clarified so many things. I think the bottom line is, if you're sick, stay home. With any, really, it should be a guideline for any sickness. Wash your hands, wear a
Yeah.
mask, get some N95, and be kind. Be kind, be patient, do the right thing, right?
I would suggest, though, I mean, because people keep saying to me, well, you're not promoting health. It's like, anybody that knows me as a doctor, that is not true. I did do a video at the beginning of COVID. At the very beginning, was talking about the foods that were high in
Oh,
zinc
I
and vitamin
remember.
D.
And you had your
Yeah,
gloves. Yeah, yeah.
yeah, yeah. So, but what I would say right now is, everybody should, like, that's something you should in the winter, take vitamin D3. And I would say anyone over the age of 1, a minimum 1,000 units. And you should get exercise, and you should get sunshine, and you should get out and socialize, and you should eat healthy, lots of plant-based foods and good quality proteins. But, the whole idea in the medical community is, don't shame those people that aren't. So people blame them, for their health. And there's a lot of victim blaming. And so I just say, if anybody gets COVID right now and has tried their best, there's no shame involved. It's very infectious, but I don't think you should ever try to get it and get it over with. I think you should try everything you can not to. And that's my philosophy. But if I get it, I'm not going to be ashamed. It's going to be like, well, it's an illness that spreads by the air. So you do your best, right?
You do your best and you cross your fingers, and and then you do feel better. I guess you do feel better eventually. We're lucky to have it being vaccinated. I don't know, even if you don't think, I can tell people, for a while I thought I would never survive, and I did. And hopefully I'll be able to to ski soon and get back on it, and then go from
Yeah.
there.
You can just imagine if you felt like this at day 18, like my friends
Oh my.
before the vaccines were available, and then ended up in hospital for weeks, and then end up feeling like this for the rest of your life. And that's what the long haulers are feeling. So, yay vaccines, because it's going to be, every time people get sick, it's going to be like, oh, that was a nasty infection,
Yeah.
but it's over with. And it's usually over with within a week when you're vaccinated.
Yeah, and I
So,
think that's the thing, is vaccine or not, you still roll the dice. So like, still do, wear the mask, wash your hands and all that, because it is a roll the dice a little bit.
yeah, yeah. Well, you do it, it's like any other illness, you try your best, but it
Yeah.
doesn't mean that you did something wrong. It just means that, you tried your best, and kids are only partially vaccinated or unvaccinated. And what we're seeing is the kids, unfortunately, are getting sick, bringing it
Stop.
home, right?
Yeah. Yeah. So back to school is gonna be super interesting. I guess we'll.
I feel sorry for parents with kids at that age, because they try, but they're kids, and what a horrible way. We want this over with. I do not want the children to wear masks next year. I want this over with. So I will do everything I can to get this community vaccinated so that we're out of this.
Yeah, and I think a lot of parents are still worried about getting the vaccine into their children, and worried about side effects and all these worries. And it's still a lot of, I guess,
I
education and so on.
I'd be much more worried about my child getting COVID and ending up with some serious.
Yeah.
And it is, this whole fallacy that the kids aren't affected. They're starting to see the kids hospitalization numbers go up, and in the US they've had some real issues. And the reality in the US is probably because some of the kids have darker skin, and they're more deficient in vitamin D to start with in northern climates. And that's not as much of our population, but again, people need vitamin D, and the darker skin you are, the less you absorb the sun, the more you need of the vitamin D. So, it's something that we want to protect people as much as we can, but our kids in Canada are healthier than US for sure. And so all those good things, and playing outside is important. But I think for the kids, the big thing is, we know the social aspect is so important. So we have such a winter wonderland playland, is, yeah, get them outside playing. I think that's really important.
They're gonna be so happy to say that the doctor said so.
Go play outside.
right, Kathy, thank you so much. I 100
Okay.
percent like appreciate it. You answered tons of questions for me and for lots of people,
Okay.
obviously. And we will see you on the ski trails.
Okay. Take care. Bye.
Thanks. Bye.